Whether you are an arachnid enthusiast or someone suffering from arachnophobia, there is no denying the dangers that surround certain spider species. Here are 8 of the worst spider bites in the world. Number 8. Simon John. A 45-year-old man's life was endangered after he was bit by a spider in August 2016. Simon John and his 5-month-old son Harrison were enjoying a family break at a holiday camp in Breen, Somerset, when they were attacked by a spider. He only noticed they had been bitten 2 days later when they returned home in Newport, South Wales. Simon John developed a fever and spotted 2 red marks on his leg that soon started to swell. His son also had a temperature, so John was rushed to the hospital together with 5-month-old Harrison. They were administered antibiotics, and the baby boy was hospitalized for 2 days. As John's infection spread rapidly, the doctors gave him a CT scan. Only then, they discovered the patient had been bitten by a deadly spider. 45-year-old John was in danger of losing his leg, as an open hole appeared on his limb and the flesh began to rot. However, the doctors managed to stop the infection and save the patient's leg, as well as his life. They had to cut out the rotting flesh to avoid blood poisoning, and during the following weeks, the doctors placed gel pads inside the skin to urge the new tissue to heal. They later told the patient that he was lucky to be alive, for if the bite had been above the groin, his organs would have shut down completely after 2 hours. Fortunately, his son Harrison did not react as violently to the spider bite and recovered quickly. Number 7. Christine McCullins. 54-year-old Christine McCullins was in danger of having one of her legs amputated after being bitten by one of the most venomous spiders in Great Britain, the false widow. She was celebrating her sister-in-law's birthday in Basingstoke, Hampshire, when the woman reportedly felt excruciating pain in her left ankle, followed by swelling in September 2013. She initially thought she had been bitten by a mosquito, so she did not pay attention to any symptoms in the following days. She treated herself with medication from a pharmacy, but the bite mark started to look even more infected and became increasingly itchier. Only a week later, McCullins went to see a doctor, fearing that she might develop a flesh-eating bug necrosis that she had previously heard frightening stories about. The doctors gave her antibiotics to stop the infection from spreading and quickly sent her home. Although the medication helped, a few days later, McCullins noticed that she had developed cellulitis around the area of the bite, so she returned to the doctor for stronger antibiotics. During the treatment, the woman said her limbs swelled and turned black, making her fear the medics would have to amputate it. McCullins, who suffers from arachnophobia, only realized she had been bitten by a false widow spider after doing research on the internet and finding photos of similar bites. However, the medication she had been prescribed by her doctor worked, and it took 3 weeks until the swelling and pain subsided, relieving the woman of the fear that she would have to have her leg cut off. Number 6. Gangrenous bite destroys woman's ear. In November 2013, a 22-year-old Dutch woman was bitten on the ear by a Mediterranean recluse spider while she was vacationing in Italy. She was allegedly sleeping when the spider attacked her and awoke the next day with the stinging sensation in her ear as her face began to swell. Soon, her ear was liquefied by the spider's venom and turned black as the skin and cartilage had died. She was reportedly rushed to a local hospital where doctors prescribed her antihistamine, as she and the hospital staff were unaware that she had been bitten by a spider. However, despite the treatment, the pain and swelling wouldn't go away. She returned to the Netherlands a couple of days later and sought medical help, but a big part of her ear was black, indicating that the cells were already dead. After further investigation, the doctors discovered the woman had been bitten by a Mediterranean recluse spider, whose venom is known to destroy cartilage as well as skin. They had to perform reconstructive surgery on the patient's ear, removing the dead tissue and replacing it with cartilage from her ribs. One of the plastic surgeons involved in the patient's care, Dr. Mariek van Wyk, reportedly said she had never seen a spider's venom kill skin before. Number 5. Casey O'Neill. A young woman was left with a hole in her leg after being bitten by what she believes was a false widow spider in September 2015. 16-year-old Casey O'Neill from Riverway, Andover, was taking a bath when she noticed what seemed to be a mosquito bite on her leg. She didn't pay attention to it until the wound started swelling and oozing blood. She went to the hospital to get treatment, but she was only prescribed cream, as the medical staff agreed they were dealing with a spider bite. However, the bite did not respond to the ointment. It started started getting even bigger until it popped, oozing blood and pus and causing her a great deal of pain. After that, Casey went back to the hospital. This time, the doctors gave the teenager strong antibiotics and a leg bandage. The woman told a news outlet that the pain was so intense she couldn't walk properly and even started to have a bad limp. Eventually, even though the wound was starting to heal, Casey had to borrow a pair of crutches from her aunt in order to be able to walk. Soon, she was taken to a third hospital checkup when she was given a final dose of antibiotics. The teenager's ordeal lasted for over a month until the bite started to heal completely. Fortunately, Casey was only left with a scar on her leg. Number 4. Ronald Reese. A 62-year-old man from Florida died on February 16, 2014, after being bitten by a common household spider. Ronald Reese was reportedly bitten in the neck by a brown recluse spider in August 2013 while he was clearing up an old house. He managed to return home, but the next day, he couldn't get out of bed anymore. Days later, Reese was paralyzed. His 88-year-old father, William Reese, took him to the hospital. The bite was followed by 6 agonizing months of pain, as an abscess had developed and ate away at his flesh towards his spine, pressing on his spinal cord. The man was in and out of the hospital, going through numerous procedures, but the pain never stopped. Reese's father told a news outlet that his son would desperately ask the nurses for painkillers, but nothing would alleviate his suffering. When Ronald finally passed, William Reese expressed feelings of relief that his son's ordeal was finally over. Number 3. Slayer guitarist Jeff Hanneman. In 2011, Slayer guitarist Jeff Hanneman was in a jacuzzi with one of his friends in Los Angeles when he was reportedly bitten in the arm by a spider and contracted a rare flesh-eating disorder called necrotizing fasciitis. He didn't pay attention to the wound during the following week, but the disease progressed quickly and started eating through the deep layers of the skin and tissue on his limb. When he noticed his arm had started to swell and turn bright red, he went to show his wife, Catherine. She immediately took him to the emergency room, where doctors allegedly debated whether they needed to amputate his arm or not. Eventually, the medical staff decided to treat Jeff's spider bite with heavy doses of antibiotics. Days later, he fell ill and was placed in a medically induced coma, as doctors had to perform multiple surgeries to remove the dying tissue. In 2011, his bandmate, bassist and singer Tom Araya announced Jeff was seriously ill. Jeff ended up contracting a bacteria that ate away his flesh on his arm, so they cut open his arm from wrist to his shoulder and they did a skin graft on him. They cleaned up. It was a flesh-eating virus, so he was really bad. In order to continue his treatment, Jeff Hanneman pulled out of his group's 2012 tour dates. Although it was announced that he had beaten the disease in 2012, the following year he was back in intensive care, and on May 2nd, 2013, Jeff Hanneman died at the age of 49 in a California hospital. His passing away was announced on Slayer's Facebook page, where the other band members reported he had suffered liver failure. Number 2. Victoria Franklin. 51-year-old Victoria Franklin arrived at the hospital in Atlanta on April 9, 2010, nearly unconscious. She was suffering from severe nausea and vomiting, and she had a swollen up black breast that had allegedly blown up to the size of a loaf of bread. The woman's breast also had a bad smell, as her twin sister Valerie DePa, who took her to the hospital, told journalists. It was ravaged by gangrene, as doctors later found out, due to a condition known as necrotic arachnidism, caused by a brown recluse spider bite. However, the patient said she didn't even remember being bit. In order to save Victoria Franklin's life, who is also a diabetic, doctors had to entirely remove the gangrenous breast. As her sister later reported, they didn't know if they could save her, as her sugar levels were extremely high. After surgery, the woman went in a diabetic coma and was placed on a respirator for 11 days. Doctors later revealed that her infection had progressed faster because of the diabetes. Number 1. Keith Pierce. Keith Pierce, a 10-year-old boy from Montana, first noticed that his leg started swelling up in September 2014. He was rushed to Bozeman Deaconess Hospital on September 30th. However, doctors looked at his leg, and after ruling out cancer, they sent him home. The little boy's leg did not start to heal, but on the contrary, the wound blackened, and his pain and symptoms worsened. His parents took him back to the hospital 2 weeks later on Friday, October 10th. After 2 days, Keith Pierce was sent into emergency surgery but he did not survive. In the early hours of Monday, October 13th, the boy's parents allowed doctors to end resuscitation efforts. It was only after forensic examination that it was determined the 10-year-old's cause of death was severe sepsis caused by complications generated by a spider bite. Keith's mother, Mandy Pierce, later revealed that the Yellowstone County coroner told her that her son had been bitten by a brown recluse spider. While filming a documentary called River Monsters, British angler Jeremy Wade caught a massive Goliath tigerfish. It was 5 feet long and weighed over 100 pounds. Shortly after returning the fish back into the water, Wade shared his impressions after having been so close to the beast.